Collapsed in co-worker's arms and they laid him down. So you're going to arrive. So upon arrival, you guys, we need to call dispatch and we need to call for backup. Okay? So you can tell them, dispatch, this is unit 131, and I've arrived to my 25-year-old male that has gone unconscious. Okay? I'll give you an update approximately in 5 or 10 minutes, and I would like a backup. I never called backup, you guys, when I went to ACP, because my call was you get called to an old folks home and you are transporting a patient to the hospital. So I thought, well, what's backup going to do for me, right? I mean, I have a driver who can help me. What do I need backup for? So I didn't call backup. So unfortunately for me, when I was done my primary survey and we loaded the patient on the cot, I said to the evaluator, okay, well now my helper, my driver, he's going to take a blood pressure and I'm going to do this. And he says, no, he's not. Yeah, he's fully trained just like me. No, your driver is driving because you didn't call for backup. So I learned my lesson, right? So if you want help to take your vitals, if you want help in the back with your patient, you better call for backup. I don't care if it's first responders, basic life support, unless it's really, really serious and you need ALS, right? So those are your choices, a BLS unit, an ALS unit, first responders, or RCMP. That's what you're calling for, okay? Okay, so approach, I've called for, I'm going to ask John, dispatch, this is unit 131, I've arrived to my 25-year-old male who's lost consciousness, and I would like a BLS unit sent to me. I will give you an update as soon as we're done our primary, over. Okay, so arrive. Your setup is done. Approach your patient, introduce yourself. Hi, my name's Linda. I'm going to be your medic, okay? Can you hear me?
I'm supposed to be able to hear you.
Sure.
Yeah.
He's a little confused. So his airway's open, he's talking to me in full sentences, right? So you're going to do a breathing rate for 15 seconds. His breathing is 16 and effective. Now on pulse, it's no longer present. I need a rate here as well. $18 times 4 is what? Go 18 times 2 is 36, 72. Okay, skin color and temp. He's normal, warm, and dry. Okay, so I'm not going to apply oxygen right away. And now you're going to do your primary, your RBS. Okay, on your RBS, that's when you do your decap, BLS, ticks, and dirt. Okay? So I'm looking for deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. Okay, you're looking for, make sure the trachea is midline, no JVD, no medical alerts. I'm feeling for tenderness, instability, crepitus, subcutaneous emphysema. And we're just going to listen to your lungs, all right? So nice deep breath, please, and thank you. Okay, one.
Yeah. Wow.
Awesome. Okay, another one.
Yeah.
Okay, another one. Sounds good. Okay, again. Thank you.
Yep,
Okay, last two. Okay, sounds good, and one more. Good, thank you. Okay, I'm feeling for distension, any rigidity, any tenderness. Okay, that's your dirt. Can you push against my hand? Okay, does that hurt? Can you cough? Does that hurt? Okay. Okay, pelvis, you're back to decap. I'm looking for deformities, contusions, abrasions, penetrations, burns, laceration, and swelling. Wet check, no blood, no urine. Okay, looking for deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. Okay, I'm going to check PMS, pulse, motor, and sensory. Pulse is good. What toe am I touching?
Big toe.
Okay, and can you wiggle, wiggle? Awesome. Okay, I'm looking for deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. Okay, I'm going to check and compare. Pulses are comparable. Wiggle, wiggle. What toe am I touching? Deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. Pulse, squeeze. Good. Finger.
Pinky.
No problem with this arm? Okay, bend. Okay, compare. Pulses are good. Wiggle, wiggle. What finger?
Index.
Index finger. Okay, BOA, blanket. Okay, oxygen. No smoking, oxygen use. We're going to give you some oxygen. It's going to make you feel so much better, okay? So, 10-liter flow with a non-rebreather. Would you like me to strap it to your head, sir, or would you like to hang on to it?
Oh, hang on to it.
You'll hang on to it. Get nice deep breaths, okay? There you go. Okay. And we're going to apply pulse ox. That's easier.
So when you're doing your RBS and you gotta say all that shit.
Mm-hmm.
What happens if you miss?
If you don't do it for your ACP licensing, it's a fail. If you guys miss something, you will be deducted. Let's say you miss something, it'll be a -3. Okay, so you have to be able to say that. So pulse, and you only have to say it once. If you say it once for me, then you can just say decap the elastics and decap the elastic. But you have to say it all at least one time, all of it. Okay? So now if you make your transport decision, you're going to call dispatch. This is unit 131. Just finished my rapid body survey. This person here, what are we going to say is wrong with this guy? He's got a GCS score of 13, we're going to say. Okay, so we're going to make him RTC, so we're going to load and go. This person classes someone's arm, no collar needed. I'll give you an update once we're on route over. Okay? So you upgrade after your primary so they know what your decision is. Are you staying and playing with this guy, or are you going to RTC this guy? Is he stable or is he unstable? Okay, now once I loaded him and I'm on route, you're going to do a full set of secondaries, okay? So patient assessment chart, does anybody have one? I'm going to go get one. So if you look on here, when I start my vitals, it's ATT, so I'm going to go LB, that's my initials. Time is 13:20. Heart rate, you can get right on here. Heart rate is 74. Blood pressure, you can do a blood pressure. For me, you're my driver, right? So he could do a blood pressure. Respiratory rate, I'll take. O2 sats is 95. Skin color and temp, I'll take again. And then pupils, close. Ooh, yeah. Okay, blood glucose. If he's confused, guess what? Altered level of consciousness, right? So if he's confused, give him a poke. Give him a test. 6.2, he's okay. Write it down. GCS scores. Eye opening, he only opens his eyes when I speak to him. That would be a 3, right? So he is confused. He's not fully oriented, he's confused. That would be a 4. And he can wiggle all his fingers and toes like I asked him, so that's a 6. He would be a 13 GCS scores. Okay, now you go on to your samples. They're not on here, okay? S is symptoms, PPQRST, so do your PPQRST. Allergies, medications, do all your samples. Head to toe, guess what? Now it's thorough. You go back and do the same thing, okay? I'm looking for deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. I'm looking for fluid in the ears. I'm looking for battle signs behind the ears. I'm feeling the neck. I'm looking for medical alerts and stomas here. Okay, nothing on your mouth, open your mouth, no breath, no odor on the breath, because diabetics have an odor, right? So it's more thorough. Okay, go over everything. I'm looking for deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. Looking for tics. Okay, I'm looking for tenderness, instability. Okay, take a nice deep breath for me. Okay, no crepitus here. Okay, and subcutaneous emphysema. I'm going to listen again. Okay, all 6 places. Okay, nice deep breath. Okay, you may not have found something the first time, but now guess what? Now you can hear something. Fluid is building in his lungs, so you might be here. You didn't hear it the first time, now the second time you do. So all 6 places again. Okay, do your dirt again. Okay, I'm looking for distension, rigidity, and tenderness. Okay, can you cough? Can you push against my hands? That doesn't hurt when you do that? Okay, good. Okay. Pushing in on your iliac crest, pushing down, no pain in there. Okay, looking for wet check, look for blood, look for urine, deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. Okay, this one's 2. Okay, now we're going to compare PMS, pulse, motor, and sensory. Okay, pulses are comparable. Wet toe.
Oh, Peggy.
Wet toe.
Big.